What is a mood? And how is a mood different than a feeling or an emotion? In our last couple videos, we talked about the differences between emotions and feelings, and this video, we're talking about a mood. Now, moods, explained very simply, are feelings that we feel over an extended or longer period of time. When we allow ourselves to stay in a feeling and not do anything to try to change it through making ourselves feel better or even changing the story that we tell ourselves in our head about what we're experiencing, then it becomes a mood. When we stay in a mood for a certain period of time, we begin to think that we are that kind of person. This is where you may tell yourself or other people, "I'm depressed," or "I'm just an anxious person." Remember that by changing the story that we tell ourselves in our head, we can change our feelings. When we change our feelings, we then stop ourselves from staying in a bad or a negative mood. So one last thing, I want to remind you that we have many emotions, many feelings, and many moods throughout our lives. You are not your feelings, your emotions, or your mood. They are simply messages from your body that are telling you something important about yourself. This is why it's really important to use clarifying language like "I feel" instead of "I am." I feel anxious instead of "I am anxious." Try this little change in your language and see if it changes the way you feel about yourself. Bye for now.
So what is a mood disorder? Mood disorders are some of the most common mental health difficulties that are in the world. Essentially, they're a group of mental health conditions that lead to disturbances in your mood or your emotional state, typically causing states of depression, so feeling quite low, and also euphoria, so feeling quite high. So like I mentioned before, mood disorders are very, very common. And Mind, the mental health charity here in the UK, estimates that in any given week, there is about 3 in 100 people who are experiencing just depression. So that's just one type of mood disorder. So if you were to obviously scale that up to the about 68 million people that are here in the UK, you can get a picture as to how common this is. That can be depressed mood, which leads to feelings of low motivation or low energy. But then you could also have mania or euphoria, which can lead to reckless behavior or feeling quite indestructible. So just to give a couple of examples, you have major depressive disorder, bipolar disorder type 1 and type 2, cyclothymic disorder, or disruptive mood dysregulation disorder. There's a lot more too. And commonly, mood disorders are treated with either antidepressants or SSRIs or even some anti-anxiety medication in order to improve the instability and stop those highs from being really high and those lows from being really low, or by engaging in psychological therapies. So your classics, your cognitive behavioral therapy, your interpersonal therapy, your counseling, and all of those things. And they help by encouraging the person to make changes in their day-to-day in order to discourage the unstable highs and lows and to encourage more stable mood that is more of a center line all the way through.
Dr. Barnes here, board-certified psychiatrist, founder of Mindful Medicine. Today we're going to go over mood disorders. I made kind of visual representation of mood disorders to get an overview of them. I call it the egg. We're going to go over it right now. So here we go. Imagine that this line right here represents a stable mood, okay? So not depressed, not manic, kind of stable. Imagine, let's make it a little longer. Okay, that's what this line represents. Now imagine this line represents depression because it's down. That makes sense, right? So this is depression. Now, let's say this line, that's as nice as I want it to be. Hang on. Let's say this line represents mania because it's elevated. Okay, so let's say this represents mania because it's elevated, right? Now, if you have a mood disorder that gets visually represented like this. From baseline normal, you can drop all the way down to rock bottom. This is what's called major depressive disorder. Okay? So I'll label that like this, MDD we'll say. So that's major depressive disorder, that's like a clinical depression. Now, let's say you have a mood disorder that goes all the way down, just like major depression, but then once at least went all the way up. Okay? Meaning you can go all the way down and all the way up. This is labeled bipolar type 1. Meaning you can meet criteria for a major depressive episode, but you can also meet criteria for what's called a manic episode. Now, let's keep going. Let's say you go all the way down, right? And you start going up, but you stop here. Okay, now notice, in this one, you can get a major depressive episode and you can become manic, but not fully manic. So you stop at what's called hypomania. That's what that is called. It's like a lighter version of mania. And what this is bipolar type 2. Characterized by a hypomanic state as opposed to a complete manic state. A lighter version, which has a specific criteria. Let's keep going, okay? There is another thing to know. We're running out of colors here. Should have brought more colors. Another thing to know, there is somebody who doesn't get all the way depressed. And they never go above midline either. And they it's the mirror image of hypomania, but on the other side. And they kind of stay in this area, but long term, longer than major depression. And this has a very specific name also. And this, where can I put it? I'll put it down here, or up here. This is called dysthymia. Also called persistent depressive disorder. They keep changing the name with every DSM. It's annoying. But dysthymia, persistent depressive disorder, meaning they don't get fully depressed, but it does last long term. There's one other thing that can be put in here. Since I'm running out of colors, I'm going to just use, I guess, this one again. One other one here is people who go down to this low dysthymic level, but also hypomanic. I know I'm messing up the graph a little bit. Try to visualize this if you can. Maybe I'll try to make it 2 colors. Okay, so again, people who get as depressed as dysthymia, not fully depressed, and then manic but not fully manic either, and they kind of sit, like in here, so to speak. It's like a combination of dysthymia, part of a dysthymia and part of bipolar 2, and this is called cyclothymia. Run out of places to put that. Let's write it here. Cyclothymia.
Some diagnoses will affect your mood, which is noticed by those around them. Psychiatry has created the DSM-5-TR handbook for a specific section pertaining to those with a mood disorder. This is where you'll find the bipolar diagnosis. Within bipolar, there's bipolar 1 and bipolar 2. And the differentiation is if one person has a manic episode. Some bipolars exist only in hypomania. This is not to be confused with panic disorder or generalized anxiety disorder or PTSD. All 3 of those diagnoses are not found in the mood disorder section. Unspecified mood disorder is a catch-all for those that seem in between bipolar and major depressive disorder. This could also be where you might have prolonged grief, major depressive disorder. For this particular disorder, you have to stay in the depressed mood for at least 6 months to be diagnosed. Whereas those with PMDD, premenstrual dysphoric disorder, may have a depressed or low mood every once in a while pertaining to their menstrual cycle. It may only last a couple of days, to the satisfaction of those around the PMDD. I should know. For women who have delivered a child, they can suffer from PPD, or postpartum depression. This diagnosis can happen up to 2 years after the child has been born. And the last diagnosis is cyclothymia. Much like bipolars, cyclothymia can have ups and downs, but it's not as debilitating as those with bipolar. It's also coined the term bipolar 3. Some of these diagnoses can have comorbidities such as ADHD, which is often linked to PMDD. And cyclothymia can also be linked to ADHD and BPD, borderline personality disorder. But BPD is not indicated under the mood disorder section of the DSM-5-TR handbook. It is located in the personality disorder section, which has clusters A, B, and C. So if you'd like to learn more, go ahead and comment, like, or follow.